Hey guys, happy Tuesday. Time for Two Bit Tuesdays. So last week I mentioned that I wanted to talk about prescription benefits this week. So I have updates on that too, but some interesting details. Whatever your medication is, not all insurance plans will cover all medications. Generics are usually pretty safe. That most plans will cover most of the common generics. Usually that's a tier 1. Prescriptions are broken into different tiers: tier 1, tier 2, tier 3, tier 4. Tier 1 is preferred generics, tier 2 is non preferred generics, tier 3 is brand, tier 4 is non preferred brand, and sometimes there's even a tier 5 for specialty medications. So, excuse me, getting insurance to cover brand and specialty medications is very challenging because not only do they want you to meet a big deductible usually before it's covered, the copay can be really high if it's going to cover your brand name medication. Sometimes they want you to try a different medication first. I'm going to get to that in a second. So if you have a plan and it looks like your brand medication is not covered, always check GoodRx and scroll down after you're shocked at the pricing, because usually there's a link to a manufacturer website that, as long as you have commercial insurance, whether it's on the marketplace, even through an employer, as long as you're not on, some of them have restrictions for Medicare and Medicaid, but you can get a discount card where sometimes your prescriptions are $0 or like $20. So that's an option. When your insurance company says, we won't cover this medication, but we'll cover that one, and you're like, well, my doctor prescribed this one. Well, doctors don't always know what they don't know what insurance will cover. 2, internal medicine primary care doctors are super busy. They do not have time to look at all the data and research on every medication, especially the new ones that come out. They are relying on the drug reps that come by their office to fill them in on information. This can be good and bad, but sometimes the doctors will go straight to the brand name medication and not try something that may cost you less money and might work just as well. Now, if you've tried the other things and they don't work, and it's not a covered medication, you can talk to your insurance company about having your doctor do a pre-authorization. And sometimes that's still required on all brand name medications. And you're going, why? Why won't insurance just cover a medication? Because medications and prescriptions are one of the most expensive things on an insurance plan. And they're trying to manage the costs so they can keep the premiums lower. And you're like, oh, my insurance premiums are high. I know, they'd be even higher if they covered Ozempic and Wegovy and all the ones you see on TV. If they just covered those, no one could afford insurance. So what the insurance companies have done is they want you to do either try some other medications that are less expensive first and see if that works. Or your doctor can do a prior authorization if you've switched insurances and now the new insurance won't cover. Well, if your doctor has a history of you showing you've tried all these other meds and they don't work, then the doctor's office can call, talk to the insurance company and say, we've already tried that tiered approach. We have the documentation. It doesn't work. My patient needs this medication. A lot of times that will work. It still doesn't mean you're going to get great coverage because it's a brand name medication. But at least it's worth a try and getting some of those costs covered for you. I've had clients complain, well, my doctor is licensed, the insurance company is not. Well, the insurance company does hire doctors to review information, and they come up with they use pharmacy benefit managers, which are middlemen, to help manage the cost of your prescriptions, which is also the reason why your prescriptions are so much, because every pharmacy across the U.S. pays the same price for a prescription. The manufacturer sells it for the same price, but when pharmacy benefit managers get involved, or PBMs, they have to get their cut. So they pass on the costs, and sometimes there's another middleman that passes on the costs until it reaches the pharmacy. And the pharmacy will determine the price based on their profit margins. Shocking. Whatever that final price was goes the same to all the pharmacies, and maybe Walgreens will charge $20, CVS will charge 25, Walmart will charge 15, and they all paid the same price for the medicine, but they're trying to get their profit margin up. That's why it's important to shop your medications, because it's the same medication. You just may have to go to different places if the savings is substantial. So keep that in mind. Do not, doctors are overwhelmed, primary care doctors, it's a volume thing. They need to see lots of patients to keep their office open. It's unfortunate that they don't have time to review all the medications and all the data and all the scientific research. But you as a patient need to look at those things too, because of side effects. Side effects are huge with a lot of those medications, and you need to make sure you understand the side effects before you decide to take a medication. Do not trust that your doctor went through all that, because they should, but I know they don't have time. I manage medical practices. I can promise you the doctor would prescribe more medications for the drug rep that brought the best donuts in the office or whatever, because, or he just liked that person, which is sad, but it does happen. Some doctors do their homework before they'll write a new prescription. Not all doctors have the time. So you as a patient have to be your own advocate. And then the other unfortunate news that happened on January 20th is there was a new executive order signed that reversed the previous executive order that lowered a whole bunch of generic medications, capped the price at $2 for Medicare and Medicaid recipients. So if you're on Medicare or Medicaid, some of your prescriptions were getting ready to be $2, no more than $2, and now that was reversed for, I don't know why that would be reversed, because the only person that benefits is Big Pharma. It doesn't help the consumer. It certainly doesn't lower people's prices, which is something that people want. People want to pay lower prices for things. It doesn't help we have inflation. And it would help greatly for these people for that medication to still be $2. The good news is it didn't affect the capped price on insulin, which is good, but maybe call your congressman. I don't usually get political, but this is something everyone can agree on. Medication shouldn't be that expensive for anyone, much less seniors who are on a fixed income. So call and complain to your senator or your congressman that you don't like that executive order getting rid of the $2 cap on generic medications. So, until next week, peace out.